My name is Dr. Ijeoma Nodem. I'm an internal medicine and pediatric physician at Wayne State University School of Medicine in the great city of Detroit. I'm also co-founding director of Wayne State University Global Health Alliance. We're a young organization, just 8 months old, but we've already made huge strides in achieving our mission, which is to build an interdisciplinary collaborative community of excellence around global and urban health and equity here in the city of Detroit. Now, as part of our work, we identified a significant problem facing the city, and that is very high rates of health disparity, especially as it relates to immigrant population. So I'm excited to propose a transformative and innovative solution to this problem. I also want to get you excited and also to solicit for your partnership, your advice, feedback, and mentorship in order to strengthen this solution as well as to improve its impact and quality. So let me shed some light on the problem. Metro Detroit is home to about 400,000 foreign-born residents. That's about 8% of the population. This population is very unique and plays a vital role to the economic and social development of the region and also the nation at large. Now, as amazing and as vital as this population is, they also suffer significant healthcare experiences, complications, and that contributes to disparities that affect the population significantly. Some of these are part of the immigrant experience itself, but also they are part of poor access due to language and cultural barriers, discrimination, the current political climate, fear of discrimination, legal and social consequences of not having adequate documentation. So about 30% of the uninsured of the foreign-born non-U.S. citizens in the Metro Detroit area are uninsured, and they do not necessarily access public health care services either for a variety of reasons. And so what we have therefore a high utilization of acute care services such as the emergency department, which impacts systemic healthcare costs by increasing them. So some of the consequences therefore that we then notice again is a high significant healthcare disparities, high healthcare costs, and also negative impact on the health experiences and outcomes of native-born residents because chronic persistent migration impacts the epidemiology of chronic infectious and non-infectious disease and health outcomes. So again, our solution is called Love on the Move, and it is an integrated immigrant mobile clinic. And so we propose to provide primary care services, nursing, pharmacy, nutrition, physical therapy, pharmacy, as I've stated, mental health, and as well as social and legal services to help with navigation of the healthcare system and services and improve linkage to care. We're actually sitting right now in one of the mobile clinic units, which we have obtained because of community partnerships that we've already begun to establish. We've identified 4 neighborhoods with high immigrant populations so that we can begin to that relationship. We're building relationships with community partners, with governmental and non-governmental agencies, immigrant community organizations, etc. We plan to ensure that all staff is trained in the Unite for Sight cultural competency course, and that we have volunteer staff that will be health professional and health pre-professional students. Our funding will come from foundation grants that we're applying for currently, and also from the School of Medicine and the Medical Center. Sustainability is to build this into a billable service eventually, and to scale up. The outcomes that we're looking for is to increase health literacy rates as well as to improve cardiovascular health risk factors such as obesity, hypertension, diabetes, and to decrease use of the emergency department and improve use of preventive services. Thank you so much. We're asking for your mentorship, your advice, and we look forward to seeing you in Connecticut.